So you were able to do that for a couple of years.
Yeah. I did that for a couple of years.
Was it Vicodin? Was it
Norcos?
Norcos.
Yeah, Vicodin, Norcos. As a dentist, we can write prescriptions for those, no problem. I mean, I can write them for oxys too, but that's a red flag to the pharmacist.
right?
Dentists, right back then, would do Norco prescriptions,
Right.
no problem. So I'd write Norco prescriptions, and I'd always mix it with an antibiotic, right, to make it look legit. Throw in a little amoxicillin, and it looks good. And I did that for years, and my office manager knew what I was doing because I think I wrote her a couple scripts or something. And something went on, and I fired her, unrelated to this. And she said to me, she said, well, I want you to continue to pay my medical. You know, I provided full medical for my employees. She said, I want you to continue to pay my medical insurance for the next year, or I'm going to report you to the dental board.
Right.
I told her, you know, fuck you, go report me.
Right.
Thinking she wouldn't, and she did. And so they did an investigation into me. About 6 months later, I had the California State Dental Board walk into my office, and with a video of me, you know, all the clips from all the pharmacies.
Oh, they just showed up at your office.
Oh, yeah.
While you're working and patients are in there.
Yep.
So you're just going to work that day, thinking everything's fine.
Yep. And
You've got everybody fooled.
Yep. Yeah, that's exactly what happened.
And did you know she had reported you to the dental
Yeah.
board?
Yes, sir.
You already knew. You already knew there was some kind of investigation.
When they showed up, I knew it was her.
Yeah.
They don't just randomly find this stuff
But before
out.
they showed up that day, you didn't know she had done
No.
that. So they show up, and you're like, oh, shit, she did report me.
Yeah, it was a big deal. It freaked me out. And they walk in, and, you know, they can, you know, they're armed. You know, they're like, at that point, I was, you know, intimidated. They're thinking they're cops, but, you know, they're armed agents, and they can come into your office, and you have to talk to them.
Oh, the dental board are like cops
Yeah, they're like dental cops.
with guns.
Yes, they have
Holy
guns.
shit.
I know, right?